Hey everybody, welcome to Rise and Reframe Physical Therapy. My name is Dr. Betty Lou, and today we are here with Gia.
Hi.
So, Gia's returning today with some knee pain, but she was a prior patient of mine at the beginning of last year.
Yeah.
For her low back. So, kind of walk us through what happened with your low back and how we kind of got out of that. What was your experience like?
So basically, my lower back started hurting because I landed in my front walkover wrong and I couldn't arch my back at all. So then I went to Dr. Betty and then she taught me some exercises for my back. And then I finally learned how to use my back correctly whenever I was doing back stuff, like back bends or some type of back walkover or front walkover.
Yeah. Are you out of pain?
Yeah.
Cool. Have you excelled in any of your movements since then? Has anything progressed? I haven't seen you for a while, so.
Oh. Yeah.
Yeah?
Yeah.
Feeling more confident in your back walkovers?
Yeah. I'm feeling a lot more confident in my back walkovers and back bends and front walkovers.
What about arabesque?
Arabesque? Oh, yeah. I've been getting recently really better at that because I learned that how to turn out my leg, like how you taught me. So then it looks better, and also so then it's less pain.
Feels better, yeah. And things are working as they should in your body and in your joints. How was your experience with Gia coming to physical therapy?
It was good. I was happy because she was able to get help for her back. And now I feel like Gia learned how, like she said, to use the correct muscles. One of the things that you taught her was to use her glutes when she was pulling through certain things. Sometimes she was just throwing herself into positions rather than using the correct muscles. So with her learning to use the correct muscles and then muscle memory, I feel that now she's doing a lot better.
Good. I'm super excited for you.
Thank you.
Overall, what dancing are you doing right now? What classes are you in?
I'm in all of the classes besides tap because I don't have room for tap in my schedule.
So how many days are you dancing a week?
4 days a week.
And how many hours?
It's around 4 hours, or in
Each
the
day,
entire
about
week.
4 hours a day? Okay.
4 to 5, I think.
Yeah.
About.
Okay, so upwards of maybe 20 hours a week. What are you doing to take care of yourself?
I'm rolling out my thighs.
Good.
And I'm doing all my stretches.
Good.
That you taught me to do. And I eat my vegetables.
Yeah, good job. I was going to ask about nutrition if you didn't bring it up. That's awesome. So you're eating a little better, staying hydrated?
Yeah.
Good. Putting the focus on you. You being your best self. I love that. So today we're here for your knees.
Yeah.
How tall are you now?
I think the last time I went to the doctor, they said 4'10".
Was it?
So tall.
Oh, wow. I guess it is about 4'10".
You're sprouting up there.
Okay.
Nice. How tall do you think you're going to be?
I think I might be 5'6".
I'm 5'7".
Really?
You got to be as tall as me.
Yeah.
Okay. Well, today we're going to get into your knees. Do you have anything else that you want to say before we start this new eval for you?
Well, thank you for helping me with my lower back. It feels a lot better.
Good. Good. Anything else?
Dr. Betty's bedside manner is absolutely amazing. Outside of Gia being her patient, I feel like Gia is Dr. Betty's little sister, her adopted little sister. She definitely treats her patients like they are one of her own. Yeah. So I appreciate that.
Can't help it. You the best. Okay, let's get into it with your knees. We're going to start with a full postural screen, and we're going to start from the beginning, okay, and see how everything's lining up. Okay. So I'll have you take off your shoes, and then I'll pop over here. I'm going to have you close your eyes. March in place for me. March, 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 march your feet. Good. And then when you're ready, you're going to stop and find the most neutral position to stand in. Do you feel like you are facing forward? Do you feel like your feet are neutral?
Yeah.
Okay, go ahead and open your eyes. All right, so We have a little bit of a discrepancy between your right and left foot. Don't move. We're just pointing things out, right? So we have our left foot forward just a bit and a slight more turnout than your right. Our arches, though, what's going on here? These are things that we talked about before, right? So our arches are a little collapsed. Our ankles are coming midline to each other. Just go ahead and relax, babe. It's okay. All right. From here, little bit of a sway back coming through. Your tilt feels pretty good, but maybe it's our rib cage that needs to come down and in a little bit. Yeah, probably closer to there. That little bit of activation that you had, that's going to be more neutral for you. Coming out of that, we're looking at upper body. We're going to have to get into these shoulders a little bit to open up, right? We don't want to have a rounded upper back. And then length through our neck and pull that back a little bit towards me. Yeah, and long. Yeah, I know, right? You just grew. There you go. We should have. Let's measure it again. We're going to be at 4'11".
Guys, I'm so sorry.
Okay, relax out of that. So just things to think about, right? I know we're here for our knees, but your stack up and your line up and your posture is going to be for being the best ballerina, dancer, let's see, jazz, hip hop, all the things, right? Dancer in general, except for tap. Which we should get into tap together. You can teach me.
Oh, yeah.
Okay, so looking at specific lower body things, we have a little bit more of a lockout on this left leg. You're coming into a little bit more of a hyperextension here, but your right leg's not doing that. So you have a little give here versus that.
Whoa,
Okay? Yeah, that's a big difference in how you're standing. So you seem to be a little, right?
That feels so weird.
And so that's the difference between your right and left leg that you weren't even thinking about. So it looks like you're a little shifted onto the left leg versus standing in between the two. I wouldn't say you're super twisted at all, but it seems like it's coming from lower. So it's not necessarily in the pelvis itself. It's somewhere in here. So we're going to look to see if your internal or external rotators are pulling one way or the other. But we know we have a little bit of a hyperextension on this left leg. Our arches are dropped on both sides. Okay, so we're going to have to work from the feet up. And then go ahead and relax for me. And then we have a little bit more internal rotation on this knee than we do on this side. So our whole leg is starting to come in a little bit more that way than we do on this one. So left leg, hyperextended, internally rotated, right leg in between. Do you have more pain on one side than the other?
I have more pain on this side when I'm like squatting or like staying like this for a long time, like in top of this position.
Okay. I was like, when are you like that? Okay. So sitting on either your toes with your knees bent as fully as they can go, that's when you start to feel pain.
And then this one hurts mainly like kind of randomly when I'm just like doing something. And it also hurts when I'm like squatting or sitting or something.
Okay. Squatting and sitting, but is that also like plieing?
Yeah.
Grand plie or okay.
Grand plie more than
All the way
normal
down.
plie.
So once you get into that full lengthened position. You mentioned earlier that you've been keeping up with your stretching and foam rolling. Are you foam rolling your quads?
Yeah.
Okay. Are you finding any tension in there?
Yeah. I found like tension recently.
Is it going away? Or is it not going away?
I think it's going away.
Okay.
But I'm not quite sure.
Okay. Are you consistent with that or is that just kind of off and on?
It's kind of like off and on because I don't know, I kind of have a busy schedule, but like there's always time, but still it's kind of more off and on.
I hear you. Okay, I'm just checking to see like where you're at and what that actually looks like. With this hyperextension, that's going to be a little bit more hamstring strength. And when we get some hamstring strength, the tone should kind of come out of the quad on this side. But making sure that we have enough tissue space there is going to be really important. So that's going to be your foam rolling. But we might need to change it up a little bit how you're foam rolling. We might need to do a little bit more active release versus just like steamrolling it, okay?
Yeah.
So let's open up. Can you show me your squat? Wherever you're most comfortable. I just want to see what you got. And then come back up. Show me how you'd sit into a chair.
Like I would like go back to sit down.
Okay. Still really knee dominant on both of those movements. So you moved your knees before you even moved your pelvis. Okay.
What the heck?
Versus, I won't let you fall. Sit. Sit, 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 sit. Bend your knees. Sitting in your hips and then coming up and out of it. So moving here, bend your knees. Before, the way you were doing it, go ahead and do it again. You drop right into your knees.
Yeah.
See how there's a difference of where your weight is shifted?
Mm-hmm.
When you drop straight down through your knees, you're putting a ton of pressure into the joint itself.
Yeah.
That's not going to go away until you fix the mechanics of how you're moving. So now let's look at your plie. So go ahead and turn it into, is it mainly in first?
Yeah.
Okay.
It's mainly first.
You tell me. So here, right? That looks a lot better than when we were seeing each other for your back. So good job there. And then come on up. Does that hurt right there?
It hurt like, it kind of has like an after result on this one, like kind of around the knee.
Around the bottom of the knee or around the whole thing if you were drawing a circle?
Like around the bottom.
Okay, so again, that pressure through your patella tendon. Okay. Show me your grand plie. And then coming back up.
That time I hurt like on the top of both of them.
Okay, so pulling through your quads. Do you feel your butt when you're doing that?
I don't think so.
What muscles are lifting you out of your plie?
My glutes.
And what else?
My core.
Okay, what else?
Inner thigh. Yeah.
Okay, so you're not driving through your quad. You're not trying to come up into an extended position. What I'd rather you be thinking about is like you just sat on a tack. You're going to squeeze your butt and come up. But I also want you to think about your legs gluing together on the inside. So this line, right?
Mm-hmm.
Try to squeeze through here all the way up your pelvic floor into your core, right? Get those ribs back, ribs and pelvis. And then move like that, okay? Try it again. Let's talk through it. So brace the belly button, ribs. Thank you. Go into your grand plie. Good. Squeeze your butt really tight. Glue the legs, inner thighs right here, right here, right here, right here. Ooh, that changed things. Right in here. Together, together, together. Tight, 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 tight. There you go. In here, okay? What does that feel like?
It felt better.
Little different?
Mm-hmm.
Did you get a sting or anything around? Less, okay.
Mm-hmm.
So you're very quad driven. So we got to find a little bit more connection. Kind of like when we did your low back, we were finding that connection to some of those stabilizers, but also your core.
Mm-hmm.
We got to do the same thing. And you have to know what muscles are working for your each move, okay? So when we're thinking about coming together in our plies, that's your inner thigh working, and we can work that.
Okay.
All right, let's take a look at your range of motion first. So go ahead and pop up on here on your back. You're such a fast learner. You're so good, girl. You're so good. Just a little education, and the more you know, the more power you have.
Oh, yeah.
Okay? Good. Stretchy girl. Ooh,
I felt that.
better, but still tight.
Mm-hmm.
You still have some range to go, especially for dance. Okay? But not bad. That way better than when I was with you for the back, right?
Yeah.
You've been doing really good. Any pinching?
Right here.
Tension?
Yeah.
What about there?
Mm-mm.
Better?
Yeah.
So there's a little bit of that pull. So when I take you into internal rotation and this muscle is getting pulled on and you're feeling that gapping right there, that's where we're going to need some length and strength. Okay. Totally fair though. Any pain right on the tendon itself?
Mm-mm.
Good. Anywhere on the sides?
No.
So nothing when you touch it, just when you use it.
Yeah.
Anything up here?
I don't think so, no.
Okay. Ready?
Yeah.
How's it feel all in here?
It feels good.
Nothing crazy?
Mm-mm.
It feels pretty good.
Yay.
Yeah, feels pretty good on the medial belly. IT band is a little tight on the side, but that's okay because you're a sturdy girl. Sturdy, strong. Anything up here?
Yeah.
Tender?
Mhm.
And you can get your foam roller in there too.
Mhm.
Okay? So that's going to go, when you do your glute, you just roll right onto the side of this hip.
Okay.
The only thing we don't go on is this big bone. You want to be above it. Okay? That hurts because we got to get this other tissue around. It's your connection point. Okay?
Mhm.
Terrible?
Kind of, yeah.
Breathe. I know. Kind of tickly. Here comes Gia's laughter, the best laughter on the planet. Everything's looking even though. Your pelvis looks good there. Not a lot of room for posterior, anterior tilt, so you're holding pretty neutral. Love that for you.
Yay.
Neat. Lining up real good. Look at that. This one's got a whole lot of room. Is this the one you throw for kicks and stuff?
Yeah, this is my good leg.
Yeah, this is your, got some mobility in there. Okay. It felt like I was just pushing through air. I was like, it's not going to stop. If you didn't have a body, I don't know how much further we would have gone. And that's the difference with like working with dancers that have different levels of mobility, and we got to know where they're hypermobile and we got to know where they're not.
Yeah.
And their normal is not our normal. Definitely not my normal anymore. I don't know if I can consider myself a dancer at this point in time, but one long day ago, I used to be. How are we feeling here?
Good.
Let it go. Good. Good. I'm going to take your top leg. We're going to bend. Brace the belly button. Hips roll forward and leg comes behind just a bit. Okay, I'm going to hold you up here. I want you to bring this bottom leg up to me. Up, up, up. Was that hard? Keep your legs straight. Straighten. Hold. How's that feel already?
Right here. It's like,
Put your head down. On your hand. There you go.
oh yeah.
Squeeze up. How's it feel inner thigh-wise? Hold it, 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 hold it. Relax. Is that hard?
Yeah.
Any pain?
No.
Okay, good. All right, let's test the other side. So
Okay.
give me a 360. What is that? 180. I lied. Oh, that works too. Good. Hips roll forward. Belly button tucked. And leg comes up. Oh, what's happening? Let's try again. Right leg, what's going on? Up,
know,
get it up there, girl. Squeeze. Take a break. We won't even play with it. Good job.
That one's harder.
What's on your shirt? You have a string. Your tag.
Oh.
Don't worry. We'll take care of you.
Yeah.
So that's going to be a lot of like your mental game, just like when we did your core and your low back, what we're thinking about when we're moving. And so now you know that when you come out of a plie, it's like you're being sucked up a straw.
Yeah.
And that you have that inner thigh moving well together and glued together. External rotation on both sides. Still needs a little bit, lefty a little more than right, but your left leg is your stance leg. So it's going to feel tighter than your right. Just balance yourself out a little bit.
Okay.
We'll work through that. Are you still in acro?
Yeah.
Yeah, so we're bending and pulling all through your joints. But if we just know where that strength is, then we know where we're going to move from there, okay? So I'm going to have you roll over onto your belly. Okay, bracing your belly, pelvic tilt down into the table. Good. A little bit of butt squeeze and draw this heel towards your butt cheek. Go, 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 go. What happened? What happened? What happened? Come on. And relax. We lost your belly button. How was that?
I definitely felt it like stretching out my hamstring.
Felt like a pull?
Yeah.
Were you going to get a cramp?
I don't think so.
Okay, good. I'm glad you're hydrated today. All right, now we're going to turn our lower leg. Good. Now you're going to be pulling again, but we're going to keep this position. So give me a pelvic tilt and a belly button tuck. There you go. And pulling, pulling, pulling. Go, 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 go. So we have 3 different muscles back here, and we gotta just see where the weakest link is. And relax. Now we're gonna go the other way. Yep, just like that. You ready?
Yeah.
Do you need a break? Okay. Belly button, a little bit of glute. Good, and pull. Up, up, up. I don't think this one's working for you. And relax. All we got right there, did everybody else see that? All we got was we just lost it. And I don't know who was trying to pull, but then nothing moved, right?
Yeah.
Okay. So now we kind of know what direction we need to be working in. But let's compare it to your other side too, so we know kind of how that balances out, all right?
Okay.
Okay. Let me move for you. All right. Normal, belly button tuck. Ready when you are. Relax. What's going on?
It didn't work.
It didn't work. Right here. This guy. Hello. That was a lot of calf. You were giving me a lot of calf.
Yeah,
I can feel it.
in my calf.
Yeah. I secretly have the same problem.
Really?
Where my calves try to do my hamstrings job.
Oh.
So we'll fix that. Don't you worry. We'll
Okay.
probably use that ARP machine to help you get some feedback into these muscles.
Oh, yeah.
Let's try again. Right here. Hello. Ready? Belly button tuck. Go.
Yeah. I don't know how to use my
Let's try right here.
hamstring muscle.
Let's give me your little belly button tuck. Good. Right here. Go. Oh, goodness. It's still calf, even on a shortened lever. Yeah. Okay. So we'll definitely work to open this calf up and kind of simmer that down by training your anterior tib. You're a dancer. You use your calf all the time. But do we use the front of our leg as much? Not so much. So, but that's going to be part of rehabbing your knees back too, is getting you some strength at the lower leg in the front, taking out some of the tone, not for the sake of muscle strength, but for that pain and that gripping of the fascia. So that's what we kind of get out of there, and bring back some attention and awareness to these hamstrings. Just like when we had to do butt squeezes and find our butt, we got to find our hamstrings now. Okay?
Okay.
Let's try our different directions. Good. Tuck, perfect. Squeeze and pull. That one's not bad. Look at that. That's a nice muscle belly right there. It's definitely not as strong as this side.
Yeah.
Relax. Which is crazy because this is your stance leg.
I know.
So I wonder where all that work is coming from. Instability, probably your calf and your foot. Maybe a little bit of the butt cheek, right? All right, tuck it down, lock in. There you go. Pull. Oh no, we lost that one right away too.
Yeah, it didn't work.
Take a break. So now we see what's happening on your left leg, which is the hyperextended one, because 2.5 of the 3 muscles, we're not getting a lot of activation. So we know now why this leg is just like ding, all the way back. Not enough tone, okay? Especially compared to your right.
Yeah.
Lay down flat for me. You always end up crooked on the table. You always wiggle to the side. And there goes her butt. See how much her butt comes off and we start to get flex? No. Stay relaxed. Don't cheat. That is still toned through the front. So even though you're a bendy girl and you can get your heels to your butt, the flare that we're seeing in your pelvis is coming from this tension across your hip flexor. That's also why it was really painful when I stuck my hand in your pelvic crest. Oh, okay. And those are going to be areas that we're going to have to get out of. All right.
Okay.
Let me just check your low back before we go. Lift your right arm for me off the table. Okay. And back down. Left arm. Relax. We need a little bit more of this left to right sling.
Okay.
Not bad. You're definitely stronger on this side. We know that's your stance leg. But even though this is your turn, kick, everything you throw, we still need a little bit more stability across this, okay?
Okay.
So when you are laying on the ground or you find time to be here, simply lifting and stabilizing your belly, giving me a butt squeeze and starting to float this leg. Yep, and just work that and then back down. And again.
Oh, this way?
Yep, same side. There you go. Good. Not rotating off the floor, but just lifting through that butt. Yep, pelvic tilt down, belly button tight. Good. Just a couple of those when you're on your belly.
Okay.
Keep this going, okay?
Okay.
Since we're here, we might as well check, right?
Yeah.
Okay. Okay, so now that we have some information on how your body's working, mechanics-wise and joint by joint, piece by piece, let's go over a couple exercises so you can start implementing them, like when you go to dance right now, over the next couple days until I see you again.
Okay.
Sound like a plan?
Yeah.
Let's start with some isometrics of your muscles. So go ahead and lay on your back. Knees bent. All the way, feet in the table. There you go. Okay, we're going to start with a hamstring isometric. So we're looking for tension here, right? All the way from the base of your knee down. What you need to be aware of is how much tone is coming through your calf. Okay?
Okay.
You're going to dig your heel into the table, and you're going to imagine you're at the beach. Beautiful sunshine.
Wow.
Waves crashing. We can turn the Alexa on if you want. Ocean sounds. Okay? And you're going to be sitting in the sun, and you're going to drag the sand back towards your butt. Then you're going to drag the sand back towards your butt. And you're going to drag it. Oh, the sand is stuck.
Oh, no.
Dig, dig, dig. Don't move. Dig, 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 dig. Where do you feel it? Where do you feel it?
Here. And like here.
Get out of your calf. Pull your toes back. Pull your toes back. Pull your toes back. Digging through the hamstring. Get out of
I
your...
feel it here now.
Good. Okay. Did it come out of here?
Yeah.
And it moved over here?
Yeah.
That's what we want. Okay.
Yeah.
We want this guy and that guy.
Okay.
Relax. Let's try the other side. Dig a couple times. Dig. Build yourself a sand wall. Dig slow, heavy digs. And then sand wall. Holding, holding, holding. Get out of this leg. Relax here. You can leave it down, you can leave it up, but it wants to be relaxed. Good.
Yeah,
I see this. This is nice. How about here?
I don't feel anything here.
Nothing yet? Okay, so now we're going to play around with length, okay?
Okay.
How far away your foot is from your butt until we can get all the way over here and feel it and all the way up here and feel it, okay?
Okay.
But for now, we just got to find the sweet spot so that we can hold and start bringing all of our friends to the party.
Okay.
The longer we hold, more friends at the party. You know what I'm saying?
Yeah.
We're bringing them all.
Oh, yeah.
Biggest party ever.
Wow.
In the hamstring, okay? So, pull back. Let's get close. Good. Hold there. And again, that pressure is not down. It's towards your butt. Better.
I feel it more.
Okay. Hold. A little bit of butt squeeze on that right glute. Breathe. That's also important. Good. I see this working. You might be a little sore first couple times you try it because you're getting really long, intense holds. How are we feeling? Hamstring? Is it waking up? Waking up?
And like I felt it in the beginning, but now it's gonna go.
Okay, then relax. Let's try a different spot.
Okay.
Let's go here. Towards your butt without actually moving. Oh, that's away from your butt. But towards your butt without actually moving.
I feel it like
closer to your glute.
Mm-hmm.
Yep. Upper thigh or upper hamstring. Good. Pulling, 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 pulling. I can see your quad trying to fire, and then your quad turns off and your knee drops down a little bit, and you get anterior tib, and then it pulls your knee down, and then your quad tries to fire, and then that's okay.
Whoa.
Things are just trying to figure, because I can see it shifting. It's like you get a tone here, and your knee pulls up, and then your knee, and then your knee drops down.
Oh.
So focus on where your pull is, right? Because even though your heel's in the ground, if you start trying to lift up, you're going to get this quad to fire. That's not what we want, right? So you're trying to dig down into the sand and pulling that sand back towards you. We don't need that.
What the heck? Can we see it?
Good. Stay there. That pull you didn't get quad, and you can see it. You're looking right at it. So good job. Good. Anything in here?
No.
Keep firing. Pull, 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 pull. Where are you pushing right now? No. Don't let me move you. Don't let me move you. Not hip flexor, butt cheek. That's why you're not feeling it, because you're pulling through your hip. Okay.
Okay.
Not going to be great on your right leg until we can find your actual hamstring.
Okay.
So then you might need to find a spot in your home or get help from your mom. But go ahead and flip over again. Sorry to make you rotisserie chicken so much, but so in this situation, you would have your mom's help, or maybe like you can do like a heavy band, or maybe go against like a door frame and find something to hook your foot against. But now your goal is a tight belly. Come down onto your elbows, off your elbows. There you go. And then kick up and hold. Breathing. How's your hamstring?
I kind of feel it.
You can or you can't?
I can.
Okay, better than the other direction. So then same thing, whoever's helping you or whatever thing you're pushing against, like depending on how large your table is, you could push against the edge of your table, right? If you're underneath it, anything like that, heavy band, whatever. Now you're same approach, though. You're going to find different lengths. So here, 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 here. It's like your leg is a little clock hand, and you're ticking through different time, different position, and being able to hold. Make sense?
Yeah.
Let's do the inner thigh.
Okay.
Flip back over. Okay. Little baby, at home. Knees bent, feet in the table. Shift your hips out from underneath you because you're twisty girl, okay? We're not doing hamstrings, we're doing adductors. So this is your zip up, and you can relax your feet unless you start to feel your calves fire. Then you'll resort to toes up, okay? But our focus right now is inner thigh and core. So now this is a zipper, okay? You're going to zip from the knee all the way up the middle of your body until you feel your core, inner thigh, and everything fire together. Close your eyes for a second. Relax your shoulders. Belly button is tight. Good. Close your eyes. Breathing. How much do you feel your right leg is working more than your left leg, or your left leg more than your right leg?
I feel like right leg is working more.
What percentage would you give it?
Like, I think 80 or 70.
Okay. And what's this one doing?
I think this one is like maybe a 60 or 70.
Okay. So you're going to try and focus on balancing that out, because right now, when your eyes are closed and you're not looking at it, you're getting a lot of shifting side to side. So it's like this guy pushes and this guy pushes, and this guy's pushing, this guy's pushing, this guy's pushing, and there's a little bit of a balance happening where they're not working together, but they're both trying to hit that 60-70%. Okay, so you want those to be synchronous, because if you're in your grand plie and your right leg pulls up faster than your left leg, then that can go straight up across your back and start bothering your back.
Yeah.
Or you'll come up and be like, why does that feel weird? Or you'll drop one heel before you drop the other. So your focus here, similarly with your hamstring, is making sure that you have enough tension and it's equal on both sides. Okay? We're starting with isometrics. So the longer we hold, the more friends come to the party,
Mhm.
and we want big parties.
Okay.
Okay? That's hamstrings, that's adductors, and you can add in the anterior tib when you flex dorsiflex the foot. Okay?
Okay.
Any questions with that? Anytime you're doing an isometric, you're not holding your breath, but you do have core tone.
Okay.
So you're still pulling up your pelvic floor into your belly button, almost like your belly button is sinking into the table and going up into your rib cage as your rib cage meets the pelvis. Shoulders relaxed. Close your eyes.
I feel it.
Do you
like,
feel it,
shifting.
huh?
Yeah.
Okay, relax. Does that feel like it's coming from a battle between these two?
Yeah.
Okay. That's going to be your focus point, all right?
Okay.
And we can isolate these too. So say you feel that and you're like, what the heck's going on? And you can't get it to calm down, lay on your side really fast. You're going to plant this foot right here. Boom. Belly button locked in. Boom. Leg extended, nice and straight. You're going to try to lift your inner thigh to the ceiling. Just like the test, but now you have a little bit of stability. You can push through this foot a little bit, brace your belly button, hold, hold, hold. Feel this. Breathe. You're not breathing. You okay?
Yeah.
You feel that inner thigh working?
Yeah. I feel like right here.
Okay. Give it a percentage. What does it feel like?
Like maybe around 7 or 60.
Okay. Let's try the other side.
Okay.
Oh, smooth. Okay. Support your head. Brace the belly button. Top leg gets planted. Good. Squeeze up. Make sure you're not using this to tilt your pelvis, okay? So you gotta
Okay.
keep that nice and tight. Hips stacked. Straighten that leg. There you go. Good. Don't sickle your foot. There you go. She said, let me use my foot to help me lift my leg. Yes, pointed feet or at least a flexed foot and you're pushing through your heel, one or the other.
Okay.
Feel what works best for you. Let's get a good hold. What do you feel?
I feel it like right here.
Okay. Give it a percentage.
Probably 70.
Oh, okay. Use this as a warm-up prior to using both legs at a time.
Okay.
Okay. If you start to feel this come up and start grabbing you here, push your leg back a little bit.
Okay.
Because what we don't want is this hip flexor doing the whole.
Yeah, because I feel like more down here than up here.
That's fine. Your muscle, the muscle belly is going to be in here.
Oh, okay.
Okay. It only comes down and attaches here a little bit, but that's going to be more tendinous, not so meaty. The main bulk is going to be in that thicker part of your thigh.
Okay.
So you're good there, but that was a good question. Okay.
Okay.
Things to work on: hamstrings, anterior tib, adductors. When we find all those muscles, we also got to get back into our mechanics. So when you are not in class, think about your butt sitting first. Practice your squat sitting back and down, but we'll kind of pull that apart and give you some things to work on too. Okay?
Okay.
Any last thoughts before we go?
No.
Okay. Did you follow everything?
Yeah.
Do you feel like you understand what's going on?
Yes.
Okay. Any questions?
No, I don't have any. Thank you, Dr. Betty.
You're welcome. Okay. Well, thanks for coming in.
Thank you.
I hope you have a great evening at dance.
Thank you.
And then we'll continue from here. But you have some homework to work on.
Okay.
So text me if you need anything.
Okay.
And then that'll be a wrap.
Yay.
So, I appreciate you coming in today.
Thank you.
Thank you guys for watching. We'll see you soon.
Oh, yeah.